So Danny already said it's a big problem. You know, we have the fact, particularly in year 6, that 37%, so over the England average of year 6s are overweight or obese. And that we've got in reception 23%, so just over the average. So there is an increasing problem as they are getting older, and we know that that problem doesn't get any better as we go into adulthood. So something's got to be done about it, and we know that actually it's not just a simple of a example of a downstream approach. We can't just ask people to do the right thing, because we know that just giving people information doesn't work. Otherwise, nobody would be doing all the different behaviours that they're doing, because the information is out there. But actually, it's being heard in various different ways, and those people that are staying for the cultural insights this afternoon will talk about exactly how that message is or isn't getting across with different communities. So we know we've got a problem. We know we've got a problem with physical activity. So in London, only 16% of children are actually meeting the physical activity guidelines. And actually, other insight shows that a lot of people just don't really realise what the activity guidelines are. There's so many different things that are confusing. And also that a lot of people say, well, actually, they are active. They overestimate the amount of activity that children are doing and the amount of activity that's actually moderate activity that they're needing to do. So it's lower than the England average. And also, 39% of children actually report walking as the main mode of transport, so it's lower than the England average. Although there is there's much more of a chance, if people don't own a car in a household, there's more chance they will walk to school. So actually, in London, there is a bigger opportunity to work with, because actually a lot of people wouldn't want to use their car to travel to schools. But so it's a different problem. It's about getting off public transport rather than necessarily getting them just out of the car. So a lot of the national messages might not cut through, because actually they're all about car use. So actually it's about thinking, how do we tailor that message locally? So we know that 8 in 10 children aren't getting the right amount of physical activity. So that is a significant number. So that's the problem. However, we're not talking about big changes, because actually we know that the opportunity is that children burn most of their energy by playing outdoors, walking and cycling, for which there are loads of opportunities. So today is focused less on sport and sport in schools, although we will talk a bit about that, but it's more about play, and we're going to hear some good examples in a minute about activities that are designed to boost that, and about walking and cycling. And actually, it's about small changes. As we're talking about physical activity, it's about using the British cycling team's approach. It's about marginal gains, because actually, if everybody if every school, if every park, if every housing policy had 1% difference that made a difference, that would add up to a huge impact on the physical activity of children. So it's not about dramatically changing things. There are loads of parks. There are loads of cycle lanes. There are loads of opportunities to walk, but people aren't doing it. So it's about how do we engage people and make it easier, but also make it more attractive and more normal. It's not normal enough to get out and play, to walk, to make active journeys. So it's about that culture shift, as well as asking individuals to change behaviour. So why don't people do it already? If all those facilities are, what makes it hard? So many of you will be aware that last year a big survey went out to Londoners around the Great Weight debate. And the findings are in, and the official document isn't released yet. And I've been told that we can share these with you, but you're not allowed to tell anybody else yet. So top secret. But I don't think they'll come as much of a surprise. But basically, as well as the food and drink options, which we talk about on another day, the environment was really important, because actually the fact that there are too many fast food shops. So we're talking about physical activity today, but actually for those planners in the room, it is an issue of how many fast food shops are around. But actually people are concerned about safety. Now that might be a perceived issue. So it also completely varies according to people's socioeconomic profile. So some literature that we'll talk about in the Cultural Insights session this afternoon looked at what are the safety concerns. And in more affluent areas, it's about road safety. So yes, the 20-mile-an-hour zones, all of those things that are perceived to make things safer are really helping. But in other areas, it's about gangs, it's about violence, it's about teenagers hanging out, it's about dogs, whether that be dog mess or dangerous dogs. And whether they are real or perceived, they are an insurmountable barrier for people. So it's about saying, how can we change that environment or change the perception of it so that people actually do believe it's safe? Because actually, when we think about the psychological influences, safety is right up at the top. So actually being able to, saying to people, be active because it's good for you, isn't enough of a priority if safety is the barrier. So actually we have to work with safety. We can't just keep telling people to get active because it's just not important enough. So we've got to think about how do we remove the barriers, not just try and make it sound better. There are also different insights, and we're going to go into this in more detail this afternoon. So apologies to those people who aren't here, because I keep talking about it, but you will get copies of the presentations in different cultural groups. And we will talk about this afternoon. You know, we actually have, so for example, in some primary schools, we have 85% black and minority ethnic population. So actually we need to be thinking about what are the specific barriers. And we know that in particularly South Asian families, homework is prioritised, educational achievement is prioritised, and that is the number1 motivator. So how do we work with that rather than against it? We know that places of worship are a real opportunity. We know they're being used brilliantly for a lot of food projects. How can we work with those? And how can we actually think about integrating physical activity? So rather than saying to people, if we want you to be more active, we need you to step out of your world and come into this physical activity, healthy activity world. How can we actually bring it and integrate the two? So it's easier to be active just by doing what we're doing already, rather than changing who we are and what we're doing. We've talked about the influence of neighbourhood. We know that there's a real lack of knowledge about the guidelines, but also there's a real lack of motivation. One of the things, we do a lot of insight work on various different issues, but the issue that keeps coming back to physical activity is that people say just they don't want to be active for activity's sake. So all those messages about get active, be active, they just, why bother is the kind of answer. So those guidelines, similar thing of like, I don't really care is the things that we hear. So how do we make people care? How do we sell physical activity, if you like, in what people are actually looking for? And probably one of the biggest barriers we have is that overwhelmingly in the insights that we've done, that's published in different literature, is that parents think physical activity is the job of schools. And schools say, we haven't got time, or we haven't got money, or all the other barriers which we'll talk about later. So we know there are some levers, which I'll talk about in a minute, which is going to mean that schools will have to do a bit more in terms of physical activity. But if we know that parents are saying that it's the job of schools, let's start with, okay, how do we work with the schools doing it, rather than try and convince parents that it's not. We need to work with the easier options and increase the potential of them to do some work. So I'm just going to share really quickly a project that we did. This was not in London, it was in Portsmouth actually, and it was about increasing access to open and green spaces, because Portsmouth has loads of open and green spaces and they weren't being used by the target families. Pretty similar to London is one of the greenest cities in the world, isn't it? So we know the places are there, but they're not necessarily being used. And what came across here was overwhelmingly the fact that parents were really motivated, like, yeah, it'd be nice. Yeah, you sell me all these happy images of happy family memories and how great this is. Wouldn't that be nice? But I can't, because actually, you know, they say that actually children like to, once they get children to the park, they love it. But actually there are lots of barriers that get in the way. So 93% of parents are saying it's really easy to encourage my kids. That's not the difficult bit. But what they said was the perception of it's not safe, but also a really interesting insight, and actually this is something that will be picked up in some of the examples that you'll hear about, is people saying, but there's nothing, what do we do when we get there? Or there's nothing there, it's just a common. Or, well, there used to be play equipment, but now there isn't. Or there's the wrong play equipment. So people needed a purpose. They will go to things, oh yeah, we went when there was that thing happening in the park, but actually we're not just going to go on our own. So how can we create a bit more of a purpose? How can we actually make things happen there? But also people didn't realise just how much was already happening in those spaces. So what was led on from that in terms of activity was about a proposition that it is easy, fun and safe for their children to play outdoors. That actually it was easy because here are all the different things that are happening. It's fun because there's activities, but it was safe. So how was that achieved? Well, looking at activity packs that went into local cafes, shops that people went to already near the park, so that actually there was something that they could do when they got there. And really promoting existing activities, treasure hunts, different things that were happening. A piece of communications activity that was just reframed. They were already doing some communications. So it's not about, this bit wasn't about changing the environment. It was actually saying happiness is on your doorstep, because what cut through with people was not the message of activity, it was the message of happy. And actually, this is happy family memories. So it was about communicating what was there just round the corner. It wasn't about saying what's happening 2, 3, 4 miles away. It was about saying just round this corner in this park, this is what's happening. But probably the most important bit was about communicating what was already happening to make the park safe. So actually saying we are doing something, and having people in those parks with high vis saying, this is what we're doing. We are making this park easy, fun and safe for you. So that actually that just people saw straight away. Nothing new happened. They just changed the way that and how they were communicating. Because saying we're doing this in your park in a leaflet that went to parents didn't get them as much as doing it at the time of when they're walking past the park and thinking it wasn't safe. So those were some kind of what you might call downstream things. That was about asking families to go and do it. But actually we know that's not enough. So with a whole systems approach, we have this complex system, and we talk about this a lot more in our systems thinking introduction. And we know that there are all these different factors that influence obesity and create this what's called an obesogenic environment. So actually it's making it really hard, really boring, really not particularly normal, and a bit of the lonely option really to do the right thing. Part of it's to do with biology, part of it's to do with individual psychology and how we make decisions and behaviour. A lot of it's to do with food consumption, media, society's influence, and then we've got our activity environment. So it's about thinking how can we use some of those things, whether it's about active journeys, whether it's about parks and green or blue spaces in terms of increasing play, upskilling communities, increasing enterprise around that, thinking about planning, thinking about housing, and we'll hear a bit about no ball games signs and how we can work with those. Thinking about play streets, thinking about schools, education, early years, whether it be through initiatives that can be bought in, like the Daily Mile, for example, which we'll talk about, or Beat the Streets, for example, or whether it's actually about the schools being a bit more accountable for what they're doing already. So the school sports premium, the fact that schools can have £9,000 of extra funding a year if they use it on promoting sport in schools, but they have to say how they're spending that money. And actually, I wonder how many schools are publishing that data and how many people are using it to increase sport with everybody rather than using it to increase sport with the people who are already sporty. So actually being accountable for that, that's something they're getting already, and they've got to share it. So we can work with some of those levers. So Pokemon Go, another example of, kids are gaming, kids are using apps of actually being able to get them to want to go and find the different clues, or Beat the Streets where they tap and then they get prizes and there's all rewards. It's not sustainable forever, because actually, it's about getting that initial excitement, but it's also about getting lots of people doing it so they see other people. But then we need to change that environment so it makes it easier to carry on that physical activity afterwards. So what do we do to make that more sustainable? And I know that in East London it's funded by the Tesco charity partnership. So again, thinking about how do we make it sustainable in terms of funding as well. We're going to hear, Debbie's going to talk about increasing play and how we actually get play happening. We've heard lots of things. Anyone here have play streets in their borough? Brilliant. And play streets is really effective One of the complaints that I know people have is that you end up getting the streets closed that actually aren't where the target problems are. So actually, how do we again think about making sure that we can make play more possible in areas where it isn't necessarily happening? How can we use community-led ideas? So Hammersmith and Fulham, I know, did a hackathon to get loads of ideas from the community to say, how do we get people to use our parks and open spaces? Actually asking people for their ideas. And really thinking about how do we tie into children's existing worlds, what they're into already, and use that to get people active. And then be able to say to parents, look, they're being active in a safe way. They're having fun. They love it. Carry it on, rather than starting from scratch. And really importantly, who do we need to make that possible? So what different departments, and what are they motivated by? So for schools, we know that it's Ofsted, isn't it? And in terms of achieving educational outcomes, we know that there is loads of good evidence now that physical activity improves behaviour, performance and attendance. The Daily Mile research project is starting to show a correlation now between outcomes and physical activity. And that's what we need. We need to go in with the initiatives that don't say, get children active because it's your responsibility because you love and care about young people. We need to be able to say, get them active because it's going to help you do your job and achieve X, Y, Z. So we know that the Childhood Obesity Plan is going to help with that in terms of the fact that from September, potentially, don't know what I'm allowed to say, not being a political person, but at the moment, from September, schools will be responsible for ensuring that half an hour of every day increases physical activity over and above PE. So be that through active lessons, through active play times, they're going to be wanting ways to get kids active because they're going to have to do it. They are also responsible for the other half an hour of making it easier for parents to get their kids active. So active travel, after school clubs, breakfast clubs, for example. So there's a huge opportunity to be really maximising the school's role in that. Also, how can we use business? How can we, when we're asking for regeneration opportunities, when we're creating employment, when we're looking at new initiatives, how can we incentivise people setting up businesses that are about a more active environment? How can we look at new businesses that start up making sure that they have a social contract, for example, to make sure that they provide facilities for people to use an active travel to work? How can we incentivise people? Because we don't do things always because we need to, we do things because we want to. And at the moment, the what's in it for me, for a lot of the partners that we need to make this possible, isn't big enough. So what have we got? What bits of legislation, what bits of policy, what bits of practice, what bit of competitive advantage have we got? So we talked the other day about some examples of street food and catering at festivals and catering at events where one local authority elsewhere in the country does half price on all trader fees if it's healthy food. And straight away, there's a big incentive for catering vans to provide something healthier. So actually thinking about how can we use those different clauses, whether it's when children are at home, so that we think about housing, whether it's at school or in early years settings, or whether it's after school and weekends. And you'll see on the posters outside some good examples of engaging those workforces. And again, making it easy, attractive, and normal, and competitively advantageous for these partners to get involved. And we need to think about not just answering our priorities, but answering other people's priorities. And Michael's going to talk in a minute about planning. You know, we know that there are various different themes in terms of what planning has to achieve, in terms of design, in terms of affordability, in terms of thinking about air quality, in terms of thinking about all these different criteria, and they are directly aligned with things that are going to reduce childhood obesity. So it's not about saying stop achieving your outcomes and come and achieve ours. It's about saying how can we both achieve the outcomes together. So thinking about those active, healthy streets and thinking about Transport for London's Healthy Streets indicators, for example, and thinking this is how we can achieve things that mean that it is a nicer environment to be in, but ultimately a healthier environment. There's a great example from Vermont in the States who struggled to get everybody involved, struggled to get everybody thinking, yeah, why should we increase physical activity? Why should we increase healthy eating? And they were also talking about smoking. And so they have a whole campaign that's overarching from communities to business to housing to planning to policy, everybody, and it's 3 for 50. And it's basically a big campaign that says there are 3 behaviours, so that's healthy eating, increasing physical activity and stopping smoking, that help stop the 4 main diseases that cause 50% of deaths. And the big shift there was from a real prevention message of healthy's great because it was about health and well-being to actually this is about everybody saving lives. Because they were saying if people do this, that's saving 50% of the deaths that are happening that are avoidable. So it's about thinking how do we motivate and get everybody involved. But it's about a shift of focus from downstream of helping people once the problem's there to upstream. And so we're really thinking about moving away from encouraging change to actually enabling it. Because we get the answer often, don't we, of I'd like to, but. And what today's about is about those buts. Is about thinking how do we take away the barriers and work with the opportunities so that we, at a policy, a legislation, a planning, housing, development level, we actually make it easier for people to do what we want them to do.